I want to bring in Dr. Jessica Shepard. She's the Chief Medical Officer at Verywell Health. Dr. Shepard, as we just heard, more than 200,000 COVID cases among kids were reported just last week. How concerning is this to you as more schools across the country are set to open for in-person classes after Labor Day?
Absolutely. As you said, that is very concerning when we see this childhood hospitalization surging in states. Now, we know from what we heard from that newscast prior is that this is mainly among unvaccinated persons, and we're seeing more than a fourfold increase in those hospitalizations, as well as seeing those being exacerbated by the RSV virus, which we typically see in these latter months of the year. So as we're starting to have more children back in the classrooms, particularly for states that don't have mask mandates, we really have to take the care in pushing the message to get our communities vaccinated, namely adults. We still have a very high percentage of adults who are not vaccinated. And also for children, as we're starting to look towards the vaccine for those in between the ages of 12 and 15, and also for those in the pediatric community that we're waiting for that vaccine to be approved.
Well, the CDC says that coronavirus cases do not appear to be more severe in children, but Dr. Shepard, we're still seeing pediatric hospitalizations going up. Why is that?
That is, again, the way that vaccines work and immunity works is that the community has to have a great percentage of people who are vaccinated in order to decrease the transmission. Now, we know that the severity of the disease in children has not been well documented and seen that we're going to see such severe cases. However, we are seeing already with hospitalizations that the transmission is occurring and increasing those numbers, and we have to stay safe by increasing the number of vaccinated persons.
U.S. health officials are hoping a COVID vaccine for kids will be available by the end of the year. How are you expecting this rollout process to go, and do you expect that we'll see many more schools, particularly elementary schools, need to shut down in the interim?
I think that what we'll see as the school year starts is that we're going to see more hospitalizations, especially going into the fall months where you're going to see more RSV and flu cases as well. So what that means is that every school district and every state really needs to take a careful look without having the vaccine for those that are younger in the pediatric community, that we have to take a stance on masks, mandates, as well as vaccinating and making sure that the adults that are surrounding these children are also vaccinated as well. Now, we know that Pfizer and Moderna are in the midst of studies when we look at the recruitment phases for clinical trials for the approval of the FDA approval rather for the vaccine in younger children. So it is a matter of time before most likely they're going to have an emergency use of the vaccine for children that we'll start to see that what we're hearing is latter portion of September into October.
The CDC is also making some unusual advice, asking unvaccinated people not to travel this Labor Day weekend. It also says that vaccinated people need to consider the risks when deciding whether or not they should travel. Dr. Shepard, put this into context for us. Have you ever heard the CDC make this kind of recommendation before?
You know, I think the CDC's responsibility is to really respond to the tone in the country at the time when it comes to disease and how to decrease that transmission of the disease. Now, when we look at unvaccinated persons being the majority of the hospitalizations in the U.S., when we come to a holiday weekend, it really is a mandate, or it should be a high recommendation for people not to travel during these times. Now, for people who are vaccinated, I still think that they can follow precautions. However, it needs to be of careful thought whether travel needs to be a big part of this Labor Day weekend and holiday weekend, again, while we're experiencing a surge and it's a significant increase in hospitalization over the country from COVID-19.
One more question for you, Dr. Shepard. How well equipped is the U.S. healthcare system to deal with the potential of another post-holiday outbreak at this point?
That's what we're seeing exactly, is when there is a strain and a stress on the healthcare system, like we saw early in the pandemic in 2020, is that we really are putting strain on healthcare workers and also the ICU when we think of ventilators and ECMO machines, which really is the halt of how we prevent people from dying when they're admitted to the ICU. So from that recommendation, from what we've seen in the past, we are really trying to prevent the country from getting to a place where we're straining the hospital system. And again, for healthcare workers that are working around the clock in order to save lives, we really have to take on this message of vaccination, because now we are realizing that the admissions are for unvaccinated persons. So the message stays the same, is that we have something that is really going to help the community. And in order to help the community, we need to increase those numbers of vaccination.
Working around the clock. Dr. Jessica Shepard, thank you for joining me, and thank you for all that you do.
Thank you.